At this time, I ask Dr. Doris Grinspun to present her CEO report to members. Doris?
Thank you, President Morgan. I'm going to take screen, please. ¿Cuál es la correcta? Esta. Ya hice. Wait. Just 1 second. Okay, here it is. Perfect. Here we go. Technology, it worked. What a pleasure to be with everybody again. And I'm afraid to say, may this be the last AGM on Zoom, because you already watched the video yesterday, which you will be able to watch at the break again. But may this be the last AGM ever again on screen. And let's be next year hugging, dancing, the way we do that always together. So RNAO, what do? We influence, we inform, we advocate, we connect, we protect, and yes, we inspire. And we inspire so much that you will see that after my speech today, the person that is coming to visit us, and is the first visit for this person, and it doesn't matter how you voted or who you voted for, our premier is coming to visit us, and it's his first visit to nurses or to anyone right after my speech. So we do inspire. We inspire those that we are always in agreement with. We inspire those that sometimes we are in disagreement. And we inspire even people that may not agree with some of the things we say or do, or that they do. And we work together. We work together, we connect, because at the end of the day, our goal is to influence and work together for a better Ontario and a better world. I hope you will see some of that in the presentation. You will see that within the ends of our board that always want to engage RNs and peace and nursing students to strengthen and increase membership, but not just because we want more members, which we do consistently, but because we want to advance the role of nurses. We want to speak out on emerging issues. We want to influence healthy public policy. And I hope you will see that we have achieved also that. And we will achieve more. Be assured of that. I want to speak during this AGM about a few items, because if we were to touch on all of them, the time will not suffice. So I will be in focus, and we will speak about RNAO and health equity. We will speak about health system transformation, and we will touch on how will it change. We will speak on RNAO and health equity and the work we have done with Black nurses and RNAO, the work that we have done with Indigenous nurses and Indigenous peoples and RNAO. And as you know, the passion that we have and the work that we do on social and environmental determinants of health. Perhaps the toughest, not just for this province, this country, in fact, for this world, is environmental determinants of health. That is where we are faulting the world all over, more than anything else. But there are aspects that we still have control within ourselves. We have control on providing better health for Indigenous peoples. And we at RNAO have an Indigenous health program that is second to none. You heard me yesterday thanking Minister Elliott, because Minister Elliott is the one that understood this and provided funding to RNAO to not only continue, but to strengthen our Indigenous focused health program. And within the Indigenous health program, I am thrilled to share with you that today we're launching the first ever best practice guideline that was produced, developed under the leadership of indigenous people working with RNAO, promoting smoking reduction and cessation with indigenous peoples of reproductive age and their communities. The first ever of many new VPGs that we will develop with our indigenous partners. We have at this point 7 indigenous PPSOs. In fact, we just launched the first ever Ontario Health Team BPSO of indigenous focus. And we are so proud of the work our colleagues are doing and so proud of the work that our colleagues at home office are leading in coaching, supporting, but more than anything, the work that the indigenous communities themselves are doing in moving this forward with the entire team. So to Grace, to Rachel, to Tanya, to Matt, to everybody that has been involved with this work, thank you. Chimigwich, for all the work that you're doing with our indigenous PPSOs, Deborah, etc. You all know who you are. If I start to say all the names, we will never finish. We also have on health equity, fully vaccinated campaign. You may remember that the work of RNAO on the fully vaccinated campaign that our colleague Victoria and communications and you led, because you colleagues are the ones that participated and sent pictures. President Offord and her son Grayson and others sent pictures and pictures and pictures and became the wall of fame of the fully vaccinated. But what was most inspiring about the fully vaccinated campaign is how we worked with vulnerable communities, how we work with indigenous peoples, how we work with communities, Black communities, with our colleagues, nurses that are dedicated to it in the field, and how we made the point that vulnerable communities needed better access, faster access to be vaccinated. On health system transformation, I'm going to touch only on a few points because again, we wouldn't have time. But the work that we have done this year on the health system transformation ranges from long-term care to nurse practitioners and RNAO, to RNs, CNSs and RNAO, to nurses' health and well-being, and soon to come mental health and addictions, which we are working there, but we are going to launch the website on that as well. On health system transformation, more often than not, we start with very, very solid reports. Reports that are filled of evidence, reports that then get legs through activation of members and the public. You have seen this past year the reports on nurses' health and well-being. You saw also the report on a comparative analysis that our colleagues Brenda State, Kim Jarvie, and the entire policy department and the Matt Calloway put together. You have seen reports after reports, and of course, the latest with the nursing crisis, and that's where we are focusing. The activation of members and the activation of the public to actually move these reports to action is tremendous. You can see here the amount of work that we have done in activating the public through Queen's Park on the Road, Queen's Park Day, Take Your MPP to Work, etc. The PPANS meeting and the activities that you do. 778 members have participated in those activities. And the long-term care, you saw the 4 hours of care, and yes, we got that. And now we are moving, of course, to moving the issues of skill mix and staffing in long-term care. And peace and their contribution to social determinants of health, and our own work on nurses' workplace, health and well-being, all through activation of members. 21 action alerts and about 26,000 responses to those action alerts. We had 6 written submissions. We had 8 letters to the editor. We had position statements. And we go on and on and on and on a variety of topics, from social determinants of health to environmental determinants of health, to health system transformation, to nurses' health and well-being and the role of nurses and what we need in order to provide the care that people need. And of course, we do speak and don't shy away on how we will be covering for all of that. On health system transformation, we were front and center to the repeal Bill 124. And yes, I have spoken with the Premier again about that bill. And yes, I will remain hopeful that that bill will be removed, and I hope very soon. Not only because it's the fair thing to do for nurses and other public servants, but also because it is what we need to lift us out of this crisis. Simply the right thing to do. You saw, those of you that went, and if you didn't go, you saw it in the social media and you saw it in our website, how much we spoke about repealing Bill 124. You saw the campaigns that we did with all politicians and the participation that they had. And you also have seen how front and center we are on IEN action campaign. And yes, there are changes with the IEN campaign. First of all, there are changes by the government that are being enacted as we speak. There are changes by the college in terms of fastening the registration and the processing of IENs, and more change needs to happen because the number of IENs living here in Ontario is astounding, and they can be a tremendous support to moving us ahead in coming out of this crisis in a better way. I have an announcement to make. We have a new membership category, Internationally Educated Nurses Associates, effective July 1st, for any RNP in a jurisdiction outside of Canada that resides in Canada and not yet registered at the CNO, has applied to the CNO and therefore has a number from the CNO, but is yet not eligible as a student associate because it's not in a school here. So July 1st, we will have a stronger, even input from IENs as an organized force to move their agenda. Health system transformation, we engage in the federal elections, both in areas of environmental determinants of health, in areas of social determinants of health, like housing, like the opioids crisis, and in areas of health system transformation. Long-term care is one of the areas that we very much try to push at the federal government, as is the areas of childcare and the areas of dental care. And of course, you saw, not just because of us, but because of the partnership between the Prime Minister and between leader Jagmeet Singh, that dental care will start to become a reality. Like, picture that, childcare is already a reality in all the provinces. Picture that, and I say picture that, colleagues, because in most countries there is done less, not more. In most countries, there are less and less services, and we in Canada must pride ourselves that we are adding services to the basket of services. Yes, more needs to be done, always. Always there is more to fill the cup more, but let's rejoice on what's going well as well. Health system transformation, we prepare everybody for the for the provincial election, issuing a platform second to none. In fact, I was so impressed yesterday of seeing MPP Arnold sending a letter to the Premier about what nurses say in the platform that needs to happen to recover from the crisis. This is an MPP that is a progressive conservative MPP, taking our platform and asking the Premier also to work together with nurses to come out of this crisis in a better way. So we have many friends in our corner. And if we push all together, things will become better. You have my word for it. Leading change. How does RNAO lead change? You all are familiar with the Queen's Park on the road. We take your MPP to work, which we keep doing virtual. And next year, that's another one in person. The Queen's Park Day, which again, we did, virtual. And yes, we had all the political parties coming, and you will see that on the video that Raul will post during the break. And you saw some of you yesterday. And next year, that's in person too. We also lead change with our new toolkit that we use for best practice guidelines. And on that, a big thank you to Catherine Wallace, to Susan McNeil, and to many others that work with an international panel and with the tremendous concept analysis to deliver that toolkit second to none and being used now around the world, colleagues. And a huge thank you to my colleague Heather McConnell and all of the associate directors for leading the best practice guidelines program, because without a program that is solid, we couldn't change nursing practice. Let me talk what we delivered for you and for the world this year. And picture it, this year alone on leading change with VPGs, just this year alone on the area of new guidelines, or what we call next edition guidelines. Next edition guidelines is like the second edition of a book, the third edition of a book. When you see there, third edition, fourth edition, that means these are guidelines that have been kept today because we have a commitment to do so every 5 years to keep the guidelines up to date. So 5 new edition guidelines: diabetic foot complications, assessment of management of pain, care transitions, which we are now developing the next edition, and it will serve for transitions across all sectors in the system for the Ontario health teams. Person and family centered care, which we are again doing the second edition. Those two, number 3 and 4, are mandatory now for all the best practice spotlight organizations. And then prevention, assessment, and management of pressure ulcers, 4th edition. And 2 new guidelines: digital health in a clinical environment, that we are doing in partnership of funding from Humber River Hospital. So a big thank you to President Barb Collins and to then Chief Nurse Executive, Dr. Vanessa Burkowski, who you will see on Saturday at the panel, for asking us to develop that guideline on digital health in a clinical environment. Again, a guideline that will lead not only Ontario, but the world in a world of digital health. Addressing racism in nursing is a guideline that comes directly from the task force recommendation. It's a guideline that we're engaging now in development of who will be the co-chairs, who will be the panelists, all Black nurse colleagues, both from Ontario, from Canada, and from abroad. This will be a transformational guideline alongside with the task force recommendations that is shaping and shaking the nursing community, that is making that we look at ourselves in the mirror and we make change happen. Leading change, as you know, we have several BPSO models. We have the BPSO Direct. They report directly to a best practice host. We have the host organizations that lead the directs, both here at home and around the world. And we have the BPSO OHT, which is the Ontario Health Teams, which the government asked us to take on. And of course, we are doing not only with pleasure, but with zest. We have now 7 BPSO OHTs being led by our colleagues, Kristen Campbell, Stephanie, Olivia, Susan, myself, and several others. And we have two types of original types of VPSOs, service organizations, which is anything from public health all the way to palliative care sectors. And we have academic VPSOs, which are colleges and universities. And now, of course, the newest kid in the block, our indigenous focused VPSOs, which are bringing and welding together wise knowledge of our indigenous people's expertise with the mainstream knowledge that the best practice guidelines program brings. We have two consortiums. We have the Latin American consortium that I am privileged to lead with colleagues that are tremendous. You saw that the Ministry of Health in Chile graduating as a VPSO host yesterday. They have already 25 direct VPSOs, and they plan to expand to all the hospitals and all primary care in Chile across the board, all of them. And we have the newest consortium that my colleague Heather McCollum is leading with the Chinese colleagues. Again, tremendous work. In Ontario, 6 new VPSOs in cohort 7 of directs, 2 new VPSOs in long-term care, 12 new VPSOs that graduated as VPSO host, 2 VPSOs Francophone, and the VPSOs OHT, 3 new ones just this year. Like, let's pause for a moment, just this year. And in Chile, Minsal with 10 new VPSOs, and Turks and Caicos Island Hospital with 1 VPSO. As I said, here is your 7 total VPSO HTs with new ones coming this year, but 3 that just came last year. Every single year we're accepting new VPSO HTs. So if you belong to an OHT that is not a VPSO, please connect with us because we have a lot in store for you and your organizations. Around the world, your face, the face of RNAO, the expertise of RNAO is being seen with awe. 18 VPSO hosts, over 1,000 organizations that formally use our guidelines through a formal agreement, through the generosity of RNAO, because we do not charge to do this work. We provide the guidelines that are on the website. We provide the teaching tools. The governments in their countries put the funding to provide the resources, to provide the champions, to support the champions so that they lead their VPSOs with our expertise to ensure that it's sustainable capacity building for their country, and many more to come. The Living Change Toolkit, it was released on January of this year. Tremendous, tremendous work, and both the framework that we all know that we have been using for years, the knowledge to action, with the new framework of social movement action framework. This is a framework no different than any other social movement, but applied to evidence uptake and sustainability. This framework is aiming, and what it does is engage champions, engage frontline providers, engage nurses and other health professionals in becoming champions of change, in ironing the wrinkles and making sure that people uptake and use evidence to provide better care and optimize outcomes for patients. But we don't just do frameworks and we don't just teach with toolkits, we also provide capacity building to events. 12,500 participants in our events this year, and guess this, they were all via Zoom. 12,500 participants that gain knowledge from our colleagues via institutes, via webinars, via champions training, via resume writing, via consultation, the wisdom in wound care webinars, the VPG institutes online. Amazing, 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 amazing people. These are the number of events, and sorry, 15,000 people participating. And again, I have news for you. I have news for you, and I'm not even giving you all the news because we don't have time, but let me give you this one. Leading Change Capacity Building. We are launching, starting in September, and you can already register on the website, a leadership and management for nurses program, started with the modules and the training for nurses in long-term care and in hospital care, and then moving to nurses in community care, inclusive of primary care, home care, and everything community in February of 2023. The beauty is it costs zero. We do not charge for these programs. People absolutely can benefit, and the organizations only need to enable the time. So the application is open. The deadline is July 11. I am told by our colleagues that we are overbooked. Keep registering, overbooked or not. If we need to put more sessions, trust me that we will. Because the staff at RNAO is a staff that is, yes, we can do it. Yes, we can do it. If people in the field, members and non-members, need capacity building to lead change, yes, we can do it. And yes, we will support you, because we believe not only bring to you expertise, we also bring energy, and my golly, do we need energy. Leading change through technology-enabled practices is very, very important in this day and age. So not only we have the apps in the gadgets that are for the VPGs, again, downloadable, free of cost. We also have the order sets, but I have a new baby in town. And this one is led by Point Click Care and by our own Rita Wilson, that is the one that led us also through order sets and is leading us now with Point Click Care to clinical pathways. This is a program that will transform long-term care. This is a program that a nurse or other health providers come to the terminal, to the liver care, and they have the entire clinical pathways for their residents in long-term care. From the full assessment from head to toe, to the guidelines and the evidence of the guidelines embedded into that assessment, into technology-enabled documents facilitated by Point Click Care. It will revolutionize the world, starting with Ontario, and then from Ontario onwards to other places. Absolutely an amazing piece of work that you will become more and more aware on the outcomes. Let me move to evaluation and monitoring of this tremendous work of the best practice guideline. First of all, we have done a lot of things that you can see there in the columns, and I'm not going to focus on that because we have still a little bit more to go. Not only we have training videos that you can see, we have OHT features with their videos and what they say. What I want to share with you is dissemination, and then I have a bit of news again. So on the dissemination, I call ourselves a scholarly professional organization that uses the evidence to move advocacy and policy change. What does it mean? It means that as a scholarly professional organization, we actually do produce evidence, we produce knowledge, and we disseminate this knowledge through conferences and through peer review publications. We have many, many peer review publications. I'm just showing a few of them. And these peer review publications reach thousands, reach millions of nurses and other health professionals all over the world. And then it is that same knowledge of those guidelines, peer review publications, evaluations, policy papers that we use to mobilize nurses to actually move from book or from paper to policy changes. And we do that by using media. Look how much we were in the media. Look how much you, our members, were in the media. Over 1,000 members, 1,400 members were in the media this past year alone. Our executive, RNAO mentions, basically no executive, no member, just RNAO for the branding and the expertise of RNAO. Almost 1,000 times RNAO mentioned without any need to say anyone else. And then almost 5,000 real exposures in the media through our work. But we don't stop there. We have increases in Facebook, in Twitter, and in Instagram. And the beauty is that RNAO brings energy to those. You have seen what's happening with social media. Social media can be very damaging and can be very hurtful and can be very divisive. And in fact, it can have also fake news, as we saw during, the issues with the mask and the issues with vaccination. It will change your DNA, et cetera, et cetera, et cetera. But social media can also be a source of strength, a source of energy, a source of togetherness. That is where RNAO is focused. And we saw an increase in Facebook, in Twitter, and in Instagram of that positive energy that RNAO brings to social media with leading change. And here is the news. Today, I am announcing the RNAO Research Unit. It will be led by Dr. Shanoya Naik, and this unit will focus on not what the guidelines we are doing, not the implementation, that is happening in the departments already, but actually on evaluating new methodologies, on evaluating indicators for success in practice environment, on evaluating the impact of the work of BPSOs and OHTs on patient outcome and system transformation. It will help us, colleagues, produce new knowledge. It will help us lead the world right here from Ontario. And that's why also we are, as you know, speaking at RNAO not only about the quadruple aim of better patient care, better patient experience, better professional engagement and professional satisfaction, which all lead to absolutely savings. Why? Because if you have less complications, if you have staffing that is very engaged, you actually deliver better outcomes. But we are also talking about social and environmental determinants of health, the SDGs, the Social Development Goals, the Sustainable Development Goals of the United Nations, because it is not the same to take care of a person in a mansion versus to take care of a person in the streets of Ontario or of anywhere else in the world. And that's why we are saying quintuple aim. Well, maybe RNAO is developing the quintuple aim that engages the quadruple aim that is critical for better outcomes and better care and better utilization of our resources, alongside with those social and determinants of health that will produce better outcomes for all. So quintuple aim. And this is the differentiation, by the way, between what the unit does and what you already saw in this presentation. While these are all the departments of RNAO, in BPGs, in advocacy, in policy submissions, presentations, all that you heard, this continues in the same mode. And the new baby in the block that I will be privileged to guide with Dr. Shanoya Naik is the research, pure bench research on all of these initiatives to produce new knowledge. And that's where we were delighted last year when Minister Christine Elliott provided funding for helping us with artificial intelligence, because this province will see more and more expertise coming out of RNAO for the benefit of absolutely everyone. And I have another news for you to tell you. You may remember that last year we announced the research chair for nurse practitioners. Well, guess what? You can apply. It needs to be a nurse practitioner with well-demonstrated research capacity and research portfolio in the areas of primary care, in the areas of research. So it will work like this. This person will be full-time employed at RNAO, part of this research unit that we are creating. And then we are going to start to work with colleagues, may I say, like some of the ones that are finishing their PhDs now, or others that have, on the areas of primary care, indigenous people's health, older adults, all of these areas, each one of them will have a nurse practitioner leading. Those will not be employed by RNAO, but they will receive support of RNAO to work with the research, with the NP research chair to develop new knowledge for the future. Because since the time that Dr. Alba Di Censo decided to retire, there is a lot of work about nurse practitioner, but it's spread and it is not all connected and collected. So this research chair, under the auspices of RNAO, working with an advisory, with a tremendous advisory that is chaired by Dr. Vicky, and working with all the universities, will deliver the output of what nurse practitioner clinical work produces for the people of Ontario and beyond. So spread the word and make sure you apply. I want to thank our board of directors. Without the board that gives me wings, and yes, I am part of the board, but I am a non-voting person and I need all of these colleagues to say, go bigger and go big. And that's what the board that we have. We have a board year after year, and I would say more and more every year, that says, keep going, keep going, keep going. And I work on making dreams reality with our staff. Without such a board, we could not produce what we have, because the board is the governance of the organization. And here is what the board said about our president. And I cannot say nothing but echo that. Kind, professional, compassionate, authentic, beautiful, yes, and today she put lipstick also. Energizing and energetic, hardworking. This is a woman that moved in the midst of the pandemic, when things were the toughest in long-term care. President Morgan Offar said, that's where I'm going. Organized, inspirational. And I also want to thank the Assembly, because with Morgan and with the board, we have worked so hard on keeping in touch with you guys, on making sure that we keep connected, that you continue to have the resources. We did President and CEO Falters. We did Assembly meetings in Zoom. We asked you to do more and more and more. And yes, you delivered more and more and more. So thank you from Morgan and myself for the Assembly. Of course, I cannot say nothing without saying thank you to our staff. Our staff at RNAO are second to none. Committed, inspiring, experts, driven. I mean, yesterday, honestly, I got afraid that President Morgan and President-elect Claudette will pull me into the rug, because we'll say, why is Daniel sending emails at midnight? Why is Ifra sending this? Why is Matt Calloway? Matt is collected. Why is he all of a sudden at 11 also answering about what we say or not in the submission? Because they're driven. That's the type of staff that we have. And to each and all, thank you. But I cannot just thank Madame Offert from the board. I need to tell you, President Offert, what the staff says to you. Approachable, any time of the day, any time of the week, any time of the weekend. Passionate, smart, brave, committed, outstanding, and more and more and more. Fearless you are, President Morgan Offert, approachable and loving. And for that, we thank you deeply. Now, I can't just only thank President Offert. There is one person I need to thank in particular at this AGM, and I hope that she attended and is attending. And that's my joining the IP, Nancy Campbell. My colleague Nancy Campbell is retiring this year. She's our Chief Financial Officer. She's retiring this year after 27 years of service to RNAO. I always say to Nancy, honestly, RNAO did good for you because you look even better than when I met you 27 years ago. You look fantastic. And yes, Eamon may think that that's him, but we think it's RNAO. So from all of us at RNAO, Nancy, thank you. This is just the beginning of the thank yous. This is the first because this is your last AGM. Wishing you a healthy retirement, Nancy. From Daniel Lau, Director of Membership, Marion Zich, Director of Communications, Matt Kelway, Director of Policy, Heather McConnell, Director of IABPG, Susan McNeil, Associate Director, Guideline Implementation and Knowledge Transfer, Nafsin Nizum, Associate Director, Guideline Development, Dr. Shanoya Nick, Associate Director and Chief Scientist, Janet Chi, Associate Director, Long-Term Care Best Practices, Louis Charles Lavallee, Chief Technology Officer, Thomas Manel, Associate Director, Information Management and Technology. He didn't know, now he knows that he is Associate Director. I always do these announcements in public so the world will know their new position. Dolores Serran, Human Resource Manager, who had, my gosh, a time this year hiring because we expanded 20 new people. Good job. Thank you, Dolores. Ifra Ali, Board Affairs Coordinator that keeps us on the running. Michelle Rangel, who just yesterday at 3 months, and she passed the probation on day 2. And Michelle Rangel is the new PG. And for those of you that remember PG, I also have news even on that. PG is pregnant and happy and beautiful. And next year we will show you pictures. So to all my colleagues in senior management, thank you. We have kept members informed. We have got awards for the work that we do. We have kept the ball running in the midst of this, yet again, intense pandemic. And you are magnificent. But the most important is you, the members. You are truly the ones leading change. You are truly the ones that our premier will be directing the remarks to in a few minutes. You are, to RNAO, the blood on our vessels. You are like what Elder Perry said, the Quaker, in the vessels that lead the change, that lead in a good way what needs to happen. And you are in all the areas of nursing practice, from policy to research to everything. And you are in all sectors of employment, from staff nurses in acute care, in government, in etc., to every other aspect of roles in nursing. And yes, we are growing in numbers, so the power to speak is even higher than before. And we are growing again. And I tell you, we are going to bring 50,000 people to the next AGM. And IFRA, we cannot do that in person, but we can bring them all. So I want to end by showing you what our members have to say. And I want to thank Raul Pinto for creating this magnificent.
Hi everyone, my name is Katrina Graham and I am the Complementary Therapies Nursing Interest Group President. We have been really busy with providing different resources for our communities and for the RNAO.
Region 10 Ottawa continues to provide monthly meetings or opportunities for professional development.
What has Nursing Through Crisis taught us? That nurses and the nursing professional needs to take the driver role. They need to be in leadership activities, engage in leadership, engage their members, and actively advocate for themselves and for their patients.
Hello, my name is Matthew McGuigan. Some of these challenges are discussed in the podcast series Public Health Nursing Stories from the Field, but many more are still yet to be told.
The year 2021-2022 has been another busy year for the International Nursing Interest Group. The INIG has 121 members as of March 2022 and is led by dedicated and hard-working executive network officers.
In February, we collaborated with the Black Nurses Leading Change Interest Group to host an event to honor and recognize Black History Month. More recently, we just finished hosting 2 all candidates meetings in collaboration with the International Nursing Interest Group.
Hi everyone, my name is Shauna Graff. I'm the chair of the MHNIG.
We were a sponsor for the Canadian Federation of Mental Health Nurses annual conference. We also contributed a presentation on the provision of psychotherapy by nurses.
ONEG has had a lot of exciting events this year. Some examples include hosting Skillshares on repairing clothing and gardening with kitchen scraps, and collaborating with Region 10 and Region 6 on a Climate Change and World Water Day event respectively.
Chapter year, we've improved our email communication with our members. Our chapter has also been involved in multiple policy and political-based events throughout the year.
Thank you so much.
Thank you.
Thank you.
Thank you very much.
Colleagues, together we make a difference. Together, amongst nurses and other health professionals, nurses and the public, nurses with government, nurses with opposition parties, nurses with the media. It is you, my colleagues, the members of RNAO, that bring the change that we want to see, and we will continue to bring change and make a better world for nurses and the people we serve. So congratulations, Chimigwich, on another successful year. Thank you, merci, gracias. And please, you can now see in your machine the new report that we are releasing today on Nursing Through Crisis, the capture of the year of work of RNAO, with many beautiful pictures, with many beautiful events, in addition to what you heard me just share. Thank you very much. It is a privilege to work with our members. It is a privilege to lead a staff second to none. And it is a privilege to be led by a board that says always bigger and better. Thank you. Miigwech to all of you.
Thank you, Doris, for your powerful report and for the incredible year of accomplishments. It is now my pleasure to invite the Premier of Ontario,